Welcome to another episode of the Just Kidding podcast. My name is Chituru, and you guys have been having fun watching all our episodes. Our yaps. I feel like we've been talking a lot. I've talked the most I've ever talked in my life in these past weeks, but I'm happy because it's disseminating information, so it's a good thing. So, welcome back. If you're new here, we talk all things insurance, but in a way that you won't be bored and slip off. So, today we're diving into big girl stuff, serious business. We're going to be talking about corporates. If you've ever been employed or you've done 9 to 5, you would understand what this episode is about. We're going to be talking about corporates and how they issue the benefits of insurance. And we all know that it's part of your benefit package, right? I think it's a law that if you employ a certain number of people, you should have access to health insurance. So we're going to be looking at all of those things and extra. Today, I have with me Tosin Awosika. She's from Tosin. Hi, Tosin. She's from SeamlessHR. She's going to introduce herself more. As you can see, we're almost matching.
Yes, we are.
So yeah, this was a match made in heaven.
Yes.
Hi,
of course.
Tosin.
Hi, Chituru.
Welcome.
Hi. Thank you so much for having me.
Oh, it's my pleasure.
So I'll introduce myself. My name is Oluwatosin Awosika. I work with SeamlessHR. I manage employee relations and engagement at SeamlessHR.
How has that been for you?
It's been interesting. SeamlessHR is very fun, so it's been an interesting experience since I joined. Yes.
So I'm just going to. So how do you feel when people drag HR people? So you know how. I mean, of course, you'd say it's been interesting working at Seamless HR, but let me put you on the spot. Will someone else from Seamless HR say it's a great place to work?
Yes, I believe so. I just met someone outside who said she's worked in SeamlessHR before in the past.
Yeah.
And she left after a while.
Mm-hmm.
And she just mentioned, how I was asking her, why did you leave?
Mm-hmm.
And she had so many good things to say about SeamlessHR. How it was so much fun.
Mm-hmm.
How it gave her like the exposure needed for a professional line. So. But I think somebody else will say the same thing.
That's lovely. So
Yes.
you guys, you know where to shoot your shot, right? List of non-toxic places to work.
I'm not campaigning.
Okay, so I'll start with an icebreaker. I hate saying it's an icebreaker because but then I just want you to tell us the most unhinged or the craziest excuse you've gotten from a staff for not coming to work. I will say mine, but I want to hear yours.
I think the common one is maybe death of a grandparent or something.
Yeah,
when
that's
it's not
pretty
really
common.
true. It's very common.
But how can you tell it's not true?
You can't tell, so you just have to tap into your empathetic part and just let it go.
Yeah.
You can't tell.
Have you ever caught someone?
Something that happens is people say when you get to a new employment, your grandparents, they come alive
They
again.
come alive. That's the perfect excuse to you.
Yeah. People say that your grandparents come alive again.
Yeah, so that's the craziest you've got.
I think
But have you
that's
ever
the
caught
most.
someone that said, I'm sick, and then they came back with a new hairstyle, looking all refreshed? You'd be like, you were sick?
Possibly colleagues.
Oh,
You
yeah.
see colleagues that I can't come to work, and then they come looking really good or with their hair made and okay.
I'm judging you.
Possibly colleagues, yeah. But you can't really say anything about it.
Yeah, you
You
can't.
can't make reference to your hair is nice.
You just
So
have to believe it.
You just believe it. Hope you feel better now. That's the only thing you can say. How did you make your hair within 2 days that you were not
Someone
feeling
came
well?
to the
Yeah.
house, I was on the bed, I didn't even make it.
Yeah, so you can't really say anything about that.
Okay, so I don't,
Yeah.
my personal example is basic. I don't want to expose myself too much because my employers watch this. So, but I have a colleague who's also a
Yeah.
friend, and
Yeah.
she took 2 days off
Yeah.
because she said she had COVID.
Oh.
But she went for a wedding. She went for a wedding, and guess what? Bella Niger posted her.
Imagine.
So everybody caught her.
How
One
do you
person caught her. I
How do you
think one
come
person
back
did.
from that?
You don't come back from it. I think it's just been this awkward silence.
Yeah.
Where everybody's like, we saw you.
Yeah.
Anyway, so let's go into benefits and HMO packages. First of all, do you agree that it's a compulsory benefit to give people, for instance, health insurance?
Yes, of course. It's a compulsory benefit. But I believe that it goes beyond it's not just a tick the box. exercise. I believe that it's not just an administrative formality. It's very important. It reflects how you view your employees. It reflects the value you place in your employees' health. So it's not just statutory. Let's just give them because it's expected.
That's the kindest thing I've heard anybody say about benefits. So it's that you're thinking about the people that you're giving it to.
Yes.
So some people just give HMO benefits to tick the box. In fact, when they're searching as the HMO person, the cheapest HMOs in Lagos State or in Nigeria, right?
Cheapest,
and that's what they give. They don't care. They don't even know the health needs of their staff. For instance, they don't know who's dealing with chronic asthma. They don't know who has blood pressure issues. They don't care about family history. Mind you, they take all of this information from you when you're about to be employed.
Yes.
But none of that goes into the actual thought process of getting a plan.
Yes.
Why? Why?
So I think that's a wrong mentality or approach to benefits. And the reason is because if you do not have proper health insurance or you don't have proper insurance because it's not just health insurance, you have personal accident and the others.
Exactly.
So if you do not have these things in place, you're in the long run, you're going to pay for it. And what I mean is when you have health insurance, there's so many benefits from it. You have reduced absences, for example.
Exactly.
So when you do not have it, you're the one losing from not
you
having these things in place.
Exactly.
Yes, people are constantly taking excuses. Oh, I don't feel too good, and it's because you don't have proper benefits in place.
Exactly.
So I think that employers need to do better in terms of health insurance.
I agree.
Yes, and I believe that it's just reflects, just like I said earlier, it reflects how much you value your employees, and your employees also see it. So when I feel very proud to say, oh, I have access to this, I have access to, even it goes beyond your healthcare. Now it's going to your mental health.
Yes, you
going
could
to
see a
things like
therapist.
spa.
Yes.
So I can say, I
Gym.
have access to this at my workplace. So it makes me feel valued as an employee as well. I trust my employer because of the kind of benefits I have.
Yeah, because I remember one of the workplaces where when you're starting off with either your first job, all of those one-man businesses, the way people call them.
Yeah.
So one of the days I wanted to take an excuse for not coming to work, and I was not feeling well. It wasn't bad enough that I had to stay at home. But in my head, I'm like, you're not in any position to tell me go to the hospital because you've not provided these benefits. Do you get?
Yeah.
So it even goes beyond corporate settings. Even people, as long as you employ any form of labor, it could be your domestic staff, it could be the drivers, it could be, do people provide that for non?
Yes, we do.
Right?
Yes.
Yeah, so it could be anyone. They could give you any excuse as to why they're not coming. There's no way to trace it back. You can't confidently say, get me a doctor's report.
Yes.
When
how?
you've not provided the resources for me to...
facilities for it,
Exactly.
yes.
So those are all the things that we consider. But for you, maybe not in Seamless HR, or I don't know if you've been in a similar role before Seamless HR, but what would you consider a good HMO package? Something that's mind-blowing. What do you look out for?
So I think that access to a wide range of hospital networks.
That's number one.
It's number one. It's priority. I would say possibly customer support as number one because of my experience. But no, I'll say access to a wide range of hospital networks is very important, especially outside major cities. So if there's a trend of you have a lot of hospitals in Lagos, but then when you're in the those other states, they don't really have access to.
True.
I remember someone once telling me that prior to Seamless HR, I remember someone was telling me that everyone in the branch uses the same hospital. So you can imagine a branch of about 15 people, everybody going to the same hospital.
Really?
And I was just thinking of how this can impact the business.
Exactly.
So if something happens and everyone is sick or something, how can you all... It's just like everyone flying on the same plane.
Yeah, too risky.
It's too risky. Too risky. And that's because of... And funny enough, this is also the person stays in a major city as well. So I think it's one major challenge that some HMOs have. And so when you have access to a wide range of hospital networks, I say that's a good HMO coverage. But then you can have access to a wide HMO coverage, but you don't have good benefits. So what I mean is your benefits can be limited. So I might be able to access all the good hospitals in Nigeria, but my benefits are limited.
I understand that.
So yes. So for example, I want to see maybe someone for my glasses, and they say, okay, yes, you can access all the eye doctors in Nigeria, all the optometrists in Nigeria. You can access all of them. But when it gets to the point of paying for your frame, we can only cover 1,000 naira. So yes, so what I mean is, so aside having access to a wide coverage of hospital networks,
the benefits
also matter. Then finally, customer support.
I was waiting for you to get to that point.
Yeah.
So tell me.
Customer support is very important, and the reason why I'm saying this is because for many HMOs, the way it's run is when you get to the hospital, you have to wait.
Yeah.
And that process of waiting,
the dreaded wait,
it can be very frustrating because sometimes you come with a bit of discomfort. You're not at the hospital to have fun.
To play and just...
You're not at the hospital to have fun. So you're already upset for being there. So having to wait, and speaking from a user's perspective, and I'm at the hospital, I'm waiting 30 minutes, an hour, and that's because I'm not getting for approvals. And then at some point, when the hospital is tired of seeing, they say, you know what, call your HMO. The way they say it is so dismissive. You know what, call your HMO.
Deal with it.
Like at this point, just call your HMO, and then you have to call customer support. If they're not very responsive, it's quite frustrating. Yeah. So I think that's also matters.
It matters a lot, because I know that. So with Skid, that's something, and I don't mean to plug Skid, but I just need to blow a trumpet a little. That has been the most appreciated benefit of people coming on Skid. The fact that it's no longer sorting yourself out with your HMO, that helpless feeling of going to the hospital, or maybe they're saying, this is not covered on your plan, or we're still waiting for approval. Most times people call us the moment they get there. Oh, I just got here and I think they just sent a mail for approval, and we're taking it up immediately and saying, oh, we have so and so person here, please approve right away. That particular service that we do, that thing, it has been a game changer for us. Everybody who sends in a review would always tell you, I never felt alone whenever I went to the hospital. Because there's that feeling of helplessness. Because I've gone sometimes to the hospital, I just want to experience it as a customer. And you see how many people are frustrated just waiting for somebody to pick their call, and then you're calling the HMOs. There's a waiting. So yeah, that can be really frustrating. It
can be very frustrating.
I can understand.
Having to wait for a while to get a response from it can be frustrating.
Have you ever been in a position where you thought a particular benefit was covered? So in your mind, you've gotten a great insurance package for your staff, and then somebody had an emergency and they needed to go to the hospital, and they're calling you, hi Tosin, they just told me this is not covered, I'm stranded, I don't know what to do. Have you ever been in such a situation?
Oh, no, I haven't. But one thing that I remembered was I've had an experience where someone told me that she was at the hospital and she had just been diagnosed with a terminal illness.
Oh my goodness.
So it was something very serious. And while they were breaking the news to her, they were also telling her that, oh, your HMO will no longer cover the test that you have to run. So there's like, you have limits to these benefits. Your HMO cannot cover this test, and you have a lot of tests to run. So it's like receiving the double bad news on the same day. One, you have to cover a lot of money for tests for you to even get a complete diagnosis, and then two,
so heartbreaking.
You just got so really bad news. So I've heard of that.
So how do you guys come in? Do you say, sorry, it's not our fault, we've already provided a package for you, sort yourself out with love, or there's a way you guys can buffer the expenses for the staff?
Yeah, so in situations like that, that's where the employee value, or you mentioned earlier, comes into place. So you value your employees, so you want to be there for them. You want to handhold them through this process. So in many cases, you have to offer support in situations like that. I also have a scenario of someone who went to play ball. You know how guys go to play ball on Saturday? Yes, and I remember this particular person went to play ball, and I don't know if it's the frustration of the entire week they take out on the ball they are playing.
Poor balls.
And they play the ball with so much energy and vigor. And I don't know how the person shot the ball and hit the person's hand. It wasn't just a dislocation. It was like it came out.
What?
It was really bad. And number one, you didn't get this injury on our premises. You didn't get the injury at work. You got it from
From
a
play.
leisure activity, from playing.
Mm-hmm.
But I remember his organization had to come into play. They had to pay for it. They paid a lot of money. They paid up to millions for the surgery. It took a while for him to get better. But the fantastic thing is, because they had personal accident plans, because they had HMO plans, every dime that they paid for his surgery was reimbursed
by the insurance.
Yeah. Yes, every dime they paid was reimbursed. So yes, I remember that happening.
So those are all the beautiful ways that insurance helps you save money. And this ties into the next question. If you're maybe analyzing costs at the end of the year, I don't know if you guys do that, where you're reviewing what was spent against benefits gotten, against the bottom line. For instance, if you're looking into people or enrollee expenses, have you ever seen a direct line between giving such benefits like health insurance and personal accident and the company saving cost? Is there a way to say we would have spent this, but this is what we spent instead? For instance, you get utilization reports from your insurance organizations.
Yes, you
do. So you're able to see, even though they won't give you specific names of the people who went to the hospital, you're able to see an overview of how much was spent at the hospitals. And imagine that was coming out of the pocket of the organization. So are those some things that give you joy at the end of the year?
Yes, of course. Of course. When you see your utilization report and you see the number of people actually visiting the hospital for one reason or the other, imagine if the organization had to pay for these things out of pocket. So, or I mentioned earlier the impact these things could have on the business. In terms of absenteeism, for example. Like, I will give a scenario of someone who has, what's common? Let's say malaria. Someone who has malaria and uses all this herbal medicine.
Agbo.
Yes, use agbo. So use agbo, and because you do not have access to HMO, you the length that it will take you to treat your malaria. Probably you'll be drinking your agbo for like 10 days. But if you go to the hospital, you take your medicine. 3 days. Most of these pills, they just night, it's 3 days.
And you're done.
So in 3 days, you're done.
You can go back to work.
Compared to when you're drinking and sipping your agbo for 10 days. So so it does help you.
I agree.
It does help you.
So in terms of making sure people enjoy their benefits on their plans, because there's something that I've noticed that's a trend. We've gotten you these plans. We've fulfilled our parts, right? If you like, don't go to the hospital when you're ill, but we've done our part. So in the organization where we work, you get regular communication to say, even if you do nothing else, go for your annual health checks. Do you guys do such things? Because people don't check themselves. It's a shocking thing. And someone is looking at me and she's never go for a comprehensive check. Right? Why don't people do it? Are they scared of what they'll find out? And how do you enforce it as someone who's responsible for such things?
So I think I won't say it's ignorance. You just prioritize other things over your health. You don't have the understanding that preventive care is cheaper than emergency care. So you don't have that understanding. So it's I won't say it's ignorance. I would say that's one major reason why. Because people just prioritize other things. You're just busy with life. Things are happening. So, but what you can do as an organization, what we do is you have your on-site checks that your HMO
that
offers.
makes sense.
So if you cannot even, since you're so busy, they are going to come and meet you.
This blood pressure, things like that.
Those BMI, your blood, they will come and do your checks at work.
Makes sense.
And that's quite different from your annual health check. Yes, that's different. So if you cannot even, and then your annual, it's important. You send out reminders. You do a campaign around it.
Imagine. For people's own health.
You do a campaign around it. And you have to go for your annual health check. And then you also aid in the process. You make it seamless for people. So people don't have to do all those, you're waiting at the lab or you're waiting. So you make it seamless for people. Just create a process around it. So that's one thing that we do.
That makes sense. So there's the part where, because I know most times there are different associations, organizations where, for instance, you're in the same group with other HR people and things like that. When it comes to conversations around benefits, especially in terms of insurance, do people rub minds and throw ideas on, even though this is not on the standard health insurance package or personal accident package? Do people exchange ideas like, I think we need to start adding things like this and communicating that? Because I think a huge part of having better plans and more comprehensive plans is when there's feedback between the actual users and the people who provide it. So are there platforms or scenarios where you guys brainstorm and say, I think we need to add more of these benefits to what currently exists? Because I know mental health packages are new.
Yes.
Did it just come up from one organization, or there are forums where people talk about these things and more benefits?
Yes, of course. There are forums where people discuss health benefits and general monetary and non-monetary benefits, and things that are just following trends.
Yeah.
What is happening now, and then just using these trends to make decisions. And so organizations, but the thing is, you can be in all these forums, you can listen to everything they say. It all boils down to, and not implement. It all boils down to your core values as an organization and the value that you place on your employees. I remember I once had a conversation with someone, and I was talking about, I think at this point we need to do the employee assistance program. And I think it's very important for employees to just have access to these facilities.
Yes.
And the person replied me and said, we don't offer that. What we offer is psychiatric care.
So when they've gone mad.
So when
madness has taken place.
This really happened.
Yeah.
It happened.
Really?
And the person said, what we offer is psychiatric care. How?
Why? Because you could offer these programs where people can find avenues to express whatever it is going on in their personal lives before it gets to full-blown.
Yes, and it was a shocker that how can you not differentiate between your employee assistance program
and psychiatric
care?
Yeah, but left.
That's what I heard. We offer psychiatry. Oh no, it was really.
And these are people who are in charge of people.
Yes.
And you're supposed to care about them.
Yes, it was hilarious.
It's crazy. So I'm going to wrap this up with just a short game. I'm going to mention random office related things, and you tell me if you would insure them or not. So this is beyond health insurance.
Okay, that works.
The office generator, would you insure it?
Yeah.
Why?
Of course, it's an asset. It's important to insure your assets as well.
Right.
Yes.
Because most people are just thinking insurance as HMO benefits. There are other things.
I mentioned personal accidents and how it helped someone whose arm was popped out. So it helps you. You need to insure your assets. You need to insure your laptops. You need to insure your whatever it is you have, your generators.
That's
you need to insure your furnitures.
Would you
have to
insure the office Bluetooth speaker?
No,
is that a petty insurance item? You just be like, hi, we have this new Bluetooth speaker. What's insure? But yeah, I like the fact that you're aware of the fact that it's not just health. There are other things that would also impact your expenses if you're not aware of insurance and its benefits.
Yes.
So yeah, do you have any questions for me?
Yeah, no, not really. I don't have any questions. I'm just happy to be. I'm just smiling.
I'm happy because you were a bit nervous initially, but this has been great, right?
Yes, it was fun. It was fun.
So you guys, thank you for listening. Thank you, Tosin. This has been really interesting, especially because I like when I see people who care about other people. And if you're in a role like human resources and you handle people's benefits, you have to care about people. Really. Because there's been this debate where they'll tell you HR, they just care about the organization and the people that they report to, not the people. There's that. People have that misconception.
Yeah.
And I won't blame them. It's been people's experiences. So it's refreshing to hear that someone would think about the people they intend to protect and give these benefits and make sure that the benefits provided actually make sense to the recipients. It's like giving me a gift and not knowing who I am. So I hope you guys have enjoyed this episode. This is not a call out, it's a call up, right? To people who administer benefits, organizations. First of all, if you do not provide health insurance, personal accident, group life, to your staff, you're doing something wrong. As long as you employ people, these are things that you have to be conscious of and passionate about. I mean, there's no excuse anymore because there are different platforms. Skid is one of them. You could come on and you could find out all the benefits that exist. No matter the size of your organization, you could always get a package that works for your employees and the people who work under you. So, this is the end of this particular episode. I hope you've learned from Tosin. Care about your people enough to give them the best. We are on all the places where we're everywhere where you listen or watch podcasts, so you could catch up on all the episodes. You could follow us at skid.ng or we as Skid on our different social channels. Until next time, thank you for listening and enjoy the rest of your day. Bye.